I'm going to start off with some housekeeping issues. The bathrooms are at the lower level. This is a continuation of a hearing that we had at City Hall. We are going to start with some of the folks that signed up for testimony last time that didn't get an opportunity. We will have a 3-minute clock. Many people submitted their testimonies in writing. We have made the YouTube, the entire hearing, the first 3 hours of the hearing is available. In the paperwork up front, you'll be able to get the entire video. As soon as this hearing concludes, we will have the entire transcript. If you want to be included in future discussions, when you sign up, please give us your email address or your address for those who don't have technology, and we will put you on the mailing list for further discussion and obviously share it with the administration. In terms of ground rules, this is a respectful conversation. We don't want people being disrespectful or shouting. If you do, we will ask to escort you out. This is an opportunity for folks to be heard. This is not to convince, argue, debate. This is an establishment of the record. We've asked the administration to come forward, and so I'm going to ask the clerk to read the title of the bill, of the resolution. And then we will begin with our first panel, and I'll also ask him to call the first panel.
Resolution number 180037, authorizing the Committee on Public Health and Human Services to hold hearings to assess the City of Philadelphia's efforts as coordinating by the Managing Director's Office and our Human Services Departments to prevent and treat abuse, addiction, and disease related to the use of opioids. The first panel is Eva Gladstein, Deputy Managing Director of Human Health and Human Services, Tom Farley, Health Commissioner of the City of Philadelphia, David Jones, Commissioner of Department of Behavioral Health and Intellectual Disability Services, and Liz Hirsch, Director of Office of the House of Homeless Services.
I want to recognize Councilman Alan Dom, who has joined me up on the podium. I don't know if you had any opening comments. And we're waiting for the chairwoman, Councilwoman Cindy Bass, that is en route. Other members, Councilman Squilla and others, will arrive as we proceed. There's additional seating upstairs if folks need additional seating for the folks who are standing up in the back. So with that, we can ask the administration to get started. Thank you.
It's on.
Is it on? Okay, thank you. Good evening, members of the committee. See if that works. Yes? Okay. Thank you for the opportunity to testify regarding Resolution 180037 to assess the city's efforts to prevent and treat abuse, addiction, and disease related to the use of opioids. I'm joined today by commissioners from 3 of the Health and Human Service Cabinet agencies. To my left, David Jones from the Department of Behavioral Health and Intellectual Disability Services. To my right, Commissioner Farley from the Department of Public Health, and to his right, Liz Hirsch, Commissioner of the Department of the Office of Homeless Services. We already testified on March 12th for several hours. Therefore, here today just to provide a quick update on that testimony on behalf of my office and those agencies so that we can enable the community members to testify this evening. Unfortunately, we believe that the opioid crisis still has not peaked. It's a national crisis, and communities throughout the country are grappling with the epidemic. We lost about 1,200 people last year, and we believe the number is still going up. Even at the height of the AIDS epidemic, Philadelphia lost 935 people, less than we will have lost last year. We are aggressively pursuing the recommendations of the Mayor's Task Force to combat the opioid epidemic, which is to slow the rate of opioid prescriptions, to educate the public, to provide treatment in more settings, and to save lives with Narcan. The opioid crisis has also resulted in growing numbers of people utilizing drugs and living on the streets. Our outreach teams and the police department are providing counts of people living on Kensington, Frankfurt, Tulip, and Emerald Streets. The count taken over the last weekend showed the total number of people living on these 4 streets at 178 people. Addressing these dual challenges of addiction and homelessness is quite difficult. However, we've been learning what seems to work. Our practice has evolved and will continue to evolve as we learn and as the crisis, or if the crisis takes on new shapes. To combat addiction, we're making sure that treatment is of high quality and effective, and removing barriers that keep it from being accessible. In 2016, Community Behavioral Health, which is the city's managed care organization for behavioral health services, served about 14,000 people who are being treated for opioid use disorder. The most effective treatment for this disorder is medication-assisted treatment, or MAT. It has been shown to be twice as effective as other types of treatment for opioid use disorder. Therefore, much of the work of DBH and CBH has been focused on increasing the availability and use of medication-assisted treatment. During the last year, we have added a new homeless outreach team and a mobile engagement unit at Prevention Point, Philadelphia. We've also developed new initiatives in the Kensington Fairhill area with teams from Prevention Point, Project Home, and One Day at a Time in order to engage individuals, connect them with services, support, treatment, and housing. We've also increased the number of days a week that on-site assessment is offered at Prevention Point, Philadelphia, and we've provided a vehicle to transport participants to treatment sites. We've added funds to a program that helps individuals to obtain identification for treatment access. To address homelessness, we are providing low-barrier housing resources that do not require sobriety. Prevention Point is now housing 40 individuals, and we'll be adding another 40 units within the next few weeks. We are also providing Housing First. Those are apartments for 75 individuals. In the mayor's budget for next year, we will add an additional respite and 60 housing units. The mayor's budget proposal includes about $4 million annually in new resources to address the opioid crisis, including this funding for the low-barrier housing. Over the last few weeks, we've been working on a pilot encampment plan that builds on the lessons we have learned. It is based on a model that was used successfully in San Francisco. We've been meeting with local civic associations and community development corporations, including West Kensington, Somerset Neighbors for Better Living, Harrogate, East Kensington Neighborhood Association, Visitation BVM, ORCA, ASE, New Kensington CDC, and Impact Services, in order to review the plans and to ask them to provide needed input. Essentially, the plan will be to begin to conduct intensive outreach and engagement for a sustained period of time at the encampments to develop a by-name list of the individuals living there and understanding what their concerns and issues are. We're establishing a navigation center that will provide respite housing for 40 individuals, and people will be able to move as a community with their belongings. We're also developing a menu of other services, including treatment, withdrawal management, mediation to enable folks to reconnect to family, ID, and access to benefits. We'll be offering all these services and setting a timeline for folks to accept these resources and leave the encampments. We'll be starting with 2 of the encampments to determine how well this will work, and also because we do have a limit to our resources. And in order to ask people definitively to move, we have to be able to offer these resources. We are not releasing the exact dates, as we believe it would interfere with our ability to carry out the outreach and engagement. Thank you for the opportunity to speak this evening. We look forward to hearing from community members.
Thank you for your testimony. I have a few questions. First, I want to thank everybody for coming out. Clearly, it's a big problem. When you get a reception like this, there's a lot of concern. So you mentioned other cities across the country, and we're not the only city that has this issue. Of all the other cities across the country, are there 2 or 3 cities that are doing a really good job in addressing this problem?
Well, I would say that we've looked to cities in terms of those who have been able to address street homelessness or homeless encampments, because we really have not had those before in Philadelphia. And what we have learned, again, is that San Francisco has had the most success, and that's who we're learning from. What I think we also understand is that homelessness in those other communities is probably not a result as much as in Philadelphia in terms of the opioid epidemic, that people are homeless for a broader variety of reasons in some of those other cities, including housing and affordability. However, a number of our staff have met over the telephone with people from San Francisco a number of times to understand how they have removed encampments, help people enter into housing and more stability.
And so specifically, you mentioned encampments and hopefully treatment. I mean, I've driven a lot of the blocks in this neighborhood, including Emerald Street, Kensington, Frankfurt Avenues, and you see how many people are living underneath the bridges, basically. Will this program address that issue? 100%, 50%? What would the residents of that neighborhood expect to see after this program?
With the beginning with the pilot, we're, as I mentioned, planning to address 2 of the encampments, and that's due to the limit of our resources, and also because we feel we're going to learn something. Unfortunately, not everybody is perfect first time out of the gate, and we'll want to be able to improve on our practice, but we would continue to work to, and we will be evaluating this. We'll be working with the University of Pennsylvania and definitely consulting with community residents to evaluate how successful it is for those 2 blocks, and then we'll come back and do the others.
So in which 2 blocks are the tests going to be on? You don't know yet?
I'm not going to address that this evening.
Okay.
We're really, I'm going to be very blunt about this. We're concerned that our ability to do outreach and do the kind of intensive engagement that's necessary might be interrupted if there's a lot of focus, particularly from the media.
Let me ask you a dollars question. You mentioned $3 to $4 million is needed for this. Is that what you mentioned?
What I said is the mayor's budget proposal includes about $4 million annually. About 2.2 of that was for low barrier housing. Some of it is to support the Hub of Hope, which another engagement center that we opened up downtown. Some of it is to increase the number of physicians who can provide medication-assisted treatment, and some of the resources will be applied in the Kensington community to help with cleanup efforts.
And to clean up and to take care of, there's 178 people you mentioned right now.
That's correct. We do not anticipate in this first pilot that we will be addressing all 178 people.
Do you have any idea how much money would be required to address the 178?
Some of it is about money, and some of it is about identifying locations. And just, for example, we're working on yet another respite, but that will take some time to do the kind of work necessary. The cost of a respite for 40 people, because we're trying to make sure they're not too large, would be about $600,000 a year, but that's not including any site, acquisition costs or construction costs. So just the operating costs for a respite.
I can only speak for myself, but I think I speak for my colleagues also that if it's more money that's required to take care of this issue, we can make it available. I think we want to get this issue resolved.
Well, and I think we would welcome additional money, but I also want to be clear that some of it is about identifying sites.
Okay. All right. Thank you very much. Thank you.
So I just want to sum up a little bit about what we discussed in the 3-hour, because I think it's important for the benefit of the residents that are here. What exactly is the entire budget from DBHDS right now on an annual basis?
So our annual budget is about $1.5 billion.
It's $1.5 billion.
Right.
And how much is dedicated to the treatment of opioid and support services?
So that the way our budget works is Health Choices really makes up, Health Choices Medicaid funding makes up about 82% of our budget. Probably, I would say, approximately half of that is dedicated towards substance use treatment or co-occurring.
So half of $1.5 billion. And Eva, you mentioned the fact that in this budget, we have $4 million in new money, including Hub of Hope, although I wanted to clarify for the record that the Hub of Hope money is different than the $2.2 million for low barrier housing that's been put here, right? So at the last session, we also talked about the number of beds and the information that's out there that at any given time, 25% of our beds are empty. I'm sorry, I want to recognize Councilman Squilla that walked in. What are we doing to reconcile the empty beds with the need as opposed to just creating the new respite centers?
So just a point of clarification. So when we were talking about, we were actually talking about medication-assisted treatment slots.
So not beds?
Not beds. We were talking about medication-assisted treatment slots. And so what we had indicated was that we had somewhere around 25% capacity. So that meant that if an individual needed to receive or participate in medication-assisted treatment, there were slots available for that individual to participate in treatment.
How many low-barrier beds do we have in the system?
We have 30.
You have to say your name for the record.
Oh, sorry. Liz Hirsch, Director of the Office of Homeless Services. We have about 3,500 emergency housing or shelter beds. The goal is for all of them to be low barrier, and then we're adding the 40 new with the new respite, and then 40 more next year. We have 1,600 transitional housing beds, and we have about I think all in about 6,500 permanent supported housing units. And we run at 90 to 120% occupancy at any given time. In some instances, we're squeezing people into rooms together, and in some cases, we may have people sitting up at night. We added about 56 additional beds this year for single women, in addition to the low barrier respites here in Kensington.
So $600,000 gives us 40 low barrier beds.
Yes, that's the emergency housing. And then the housing, first, the permanent supportive housing units run about $15,000 per year per unit. And our estimates are that citywide, we would need about 2,000 more of those units to address the street homelessness throughout the city.
So to Councilman Dom's point, in a system with $1.5 billion and a budget of $4 billion, the allocation of $4 million for what you describe as a crisis does not appear to be a crisis.
So just to be clear, the homeless services budget is about $80 million. The DBH budget is the $1.6 billion. They're two different pots of money that we manage and that have a different set of uses and restrictions.
No, and at our first hearing, we clarified a little bit about low barrier $40 beds, $150 beds, $300 beds. I think, and you know, I'll concede to Councilman Squilla if he has a few questions, because we do want to quickly move to the community. It is very hard for us to explain, and I think the people will talk eloquently for themselves, that in a system of $1.5 billion, a budget of $4 billion, that we're saying we need 2,000 beds. And we have a crisis, and we allocate $4 million.
Just one point of clarification. The $1.5 billion is really for it's health care, so you really can't use that Medicaid funding for beds. I just want to be clear about that.
Although, in the last hearing, you did acknowledge that there's about 80 beds that CBH is paying for actively right now.
And those were a part of, as I had indicated, they were part of a treatment. So if, in fact, someone, for example, was getting substance use treatment and they were part of Journey of Hope, that was a treatment that was a bed attached to it, but those also were temporary. Those were not permanent supported.
Okay. Councilman Squilla, you had...
Thank you, Madam Chair. And I'm not going to ask a lot of questions because I know we want other people to speak, not like last time. But we had talked about getting people into services, and is there anything we're doing to maybe extend the timeline that when people come into a facility, that we could take 24 to 48 hours, get them the assistance they need, and then get CBH or DBH the information that then they could be reimbursed for.
So I think what we're trying to do is really look at any barriers that prevent individuals from being able to access treatment. The challenge around accessing treatment really has been around having identification and accessing medication-assisted treatment. That really has been, you really don't require, there's not a requirement for mental health, co-occurring, or other levels of care. So it really has been around MAT, medication-assisted treatment. And again, we're trying to do everything we can to reduce those barriers. Some of that, again, is those are both kind of federal and state regulations.
But if can we allow them, the provider, more time to get that information to us while they're treating them? Or they're saying and if they, I mean, it would be both that they would take a risk and we would take a little bit of a risk, but if they didn't get approved, they wouldn't get reimbursed. But they know that these people need the treatment right away, so they're trying to get them into assistance.
Yeah. So what we also are exploring is looking at withdrawal management, which would then allow for an individual to go directly into treatment. I think it's the point that you're making, and then have those issues in terms of the detoxification that would occur while they're in treatment, have that happen. Again, they wouldn't then have to go into what had historically been detox for 3, 5, 7 days and then transition to treatment. So we are exploring that. There are a couple of providers that are currently operating withdrawal management in our system.
So we're doing that right now?
Within a couple of providers, yes.
And we're going to expand that to all of them?
Well, we're going to make every effort to expand it to different levels of care.
Okay, and one last question was, so if we give that flexibility to the providers there, we'll be able to get more people into treatment, correct?
That's the goal.
And therefore that barrier will then be removed. And now one last thing, and I know because the state also has deemed this a crisis, and they were supposed to ease up on some of the qualifications for treatment. Have we seen that?
They have removed some barriers. They unfortunately have not removed the identification barrier, although they're making it easier for some people to obtain their birth certificates.
So still, if you don't have ID, you can't get treatment.
Well, and again, that's certain levels of that. So that really is around where you're going to get treatment for opioid use disorder. Broadly, in terms of if you want to come in, right? If you want to come in for treatment for mental health, to have your mental illness treated, you actually don't necessarily require an ID. So I just want to be really clear about that.
And that's something recent as a result of some of these public discussions, because you have the ability to waive the ID requirement if you want.
Yeah, so again, Councilwoman, that's not a Philadelphia Institute of Regulation. That actually is both state and federal.
But we can choose with our matching city money to waive it if we want. We choose not to. We've done it in the past.
Yeah.
We choose not to.
Yeah, I'm not aware of that.
Okay.
Okay,
We have. And the providers who will testify later, I will specifically ask them those questions because we have waived it.
And I just want to add that in order to get into a respite or emergency housing, you do not need ID.
And is that new or is that?
No.
Okay.
Could I add one other response? I think to enable people to get withdrawal management at locations that are providing other services, what the goal is that they won't have to kind of leave one service to connect to treatment, and so there'll be fewer people who kind of fall out of this system because they're not having to complete detox and then go someplace else for treatment and get a new assessment.
Okay. Again, we don't want to consume all of the time with this discussion, and we can have a broader systems discussion. I encourage folks to go on the website and look at the previous discussion we had around this hearing. I appreciate the fact that CBH and Dr. Jones did submit some of the public information. I encourage people to go on CBH's website. I will note that on there, we still did not see a board of directors. We still did not see a public listing of meetings. And so we will continue to ask for the highest public transparency around the decision-making around providers and accessibilities. Let me also put on the record that I think it is hugely important that we develop a patient's bill of rights, and that the directory, the Excel directory around the providers that was established on the CBH, while it's a very good start, it does not provide patients with the ability to see clinics, whether they're profit or for-profit, CEO, board information, or any of that. So we'll continue to work on that. So I'm going to ask the administration if they can, and you guys have agreed to sit through some of the discussions. I'm going to call the next panel. You have another question? I'm sorry. Councilman Dahl.
This is just a question. Do we as a city have a comprehensive plan on how we're going to deal with this issue and what it would cost us to take care of this issue 100%? And if we can't formulate it as a city, is there someone on the outside who can help us formulate it?
And by this issue, do you mean the opioid epidemic?
Yes.
We have a comprehensive plan. It's in the 18 recommendations from the mayor's task force. We did not try to price that out. I'll look to Dr. Farley to see if he knows of any city or other jurisdiction that has been able to do that.
Yeah, I don't know of any jurisdiction that has priced that out. And those were the 18 recommendations. The crisis has continued to get worse here, as in every other city in this country. So it evolves, and so new situations are going to come up, and so there may be issues that we'll have to do new things beyond what those recommendations were, which were done put out in May of 2017. But that is the administration's plan, and it was a plan that was developed by more than 150 people, lots of public input, listening sessions, tremendous community involvement in the development of that plan.
But it sounds like to me that we know this is an epidemic, a crisis, but there's no concrete plan of how we're going to solve it.
So I think, Councilman Dome, I think what the 18 recommendations that was put forward by the task force, I think represents a comprehensive plan. We've actually been making progress on implementing those recommendations. And so I think that plan is pretty comprehensive. It just does not have, it doesn't have dollars attached to each of the recommendations.
I guess I'm going to break it down now. I live, for example, a half a block from, pick one of the streets where there's an issue, Frankfurt or Kensington or wherever. And I have two kids, okay, who are ages 4 and 8, and they have to walk through there every day. I would flip out on the city. I'd be like so upset, and that's why I'm here tonight. I mean, I am only here because when I ran for office, Councilwoman Sanchez took me on a tour of her district and showed me what was going on. I was like flabbergasted that this was occurring. So we can't let this as a city occur, and this has not been really resolved in the last few years. We've moved people from 3rd and Indiana, but now they're in different areas, and I don't see a concrete plan to deal with 178 people and the bigger problem that we need to solve, because people aren't going to tolerate it.
If I could just add to that, this is a crisis. It has many different manifestations to it. You're focusing on one, which is homelessness associated with opioid use. Other manifestations include overdose deaths, which is, as the health commissioner, that's the one that I focus on the most. Includes babies born addicted. It includes people who are not functional in the workplace because they're using opioids. It includes many other things. The mayor's task force was trying to address everything. Meanwhile, the crisis continues to get worse here as in every other city because of the arrival of fentanyl. So does there need to be further development? Sure, but there has been more development of the homeless-related plan. So I wouldn't agree with the claim that we don't have a plan for this. I do think we have a plan, but the crisis continues to evolve, and we're going to have to continue to evolve a plan with it.
Well, I guess my point is that we should take more efforts to step up the plan and have a more comprehensive plan and put more money towards it, because it is a crisis. I'd be in favor of that, even though I'm usually pretty conservative on spending money. But this is an issue that we have to address. So just to give my thoughts, thank you very much. Thank you, Madam Chair.
And Madam Chair, I just want to make one last comment. I'm not going to ask a question, but knowing that these recommendations, really none of them included the encampments. So even though we had those recommendations, we didn't include encampments and how we're dealing with that and the quality of life issues surrounding that, not only for the people that are living there, but for the surrounding communities that have to deal with it.
And if I can respond to your comment,
Okay,
Councilman, I know you're trying to get us off the stand here. Yes, that's a point I was going to make, and I think it's well taken. It's one that developed, I think, as we were working on the task force, so it wasn't evident at the beginning. There's been a tremendous amount of work that we have done with community partners, although it is not addressed in the mayor's task force plan. You know, that includes litter cleanup, includes beautification of a number of blocks, and includes El Barrio Nuestro, the organizing work, and work that we're doing with the community development corporations. I think the specific issue that Councilman Dom has mentioned, which is actually removing people who are now residing on the streets, is one that we've been working on in a very concentrated effort for the last several months. This is new for us. We're working really hard to get something done that will be effective, that will stick, and that we can then replicate. And again, we've been trying to meet for probably about 6 weeks or more with the civic associations most directly affected and the community development corporations, because they're living with it every day, and we think it's important to have their input and frankly, their support for doing it. We will learn from that, and then we will address the others. But I think that this was not work that we envisioned when we started out a few years ago, and it's part of why my statement said the crisis is taking new shape, or different shapes, and we have to learn, and our practice has to continue to evolve.
Again, as I said before, this wouldn't happen in any other part of the city. And I don't, as much as I appreciate all the work, I don't think that you understand that we cannot wait for 2 weeks for you to do 2 and then tell us that all summer to do another 2. And so I'm going to repeat what I said last month. We need to see by the end of this budget process the numbers. We know what the $40 beds, the $150 beds, the $300 beds, the $15,000, we know all of that. We also know that of the 178 people there, not everybody's going to want services, and we'll let Jose Benitez come up and at least talk a little bit about what we know has been working and why we're not doing more of that as we look at other options. But I think that the administration thinks they have more time than they do. And as a resident of this neighborhood, we do not have the time that you think you have to get this done. And if you wanted to add something, I'm going to call the rest of the folks. Yeah. So I'm going to call the next panel. And again, some folks submitted written testimony. If you're here from the last panel that we overlooked, and if you haven't registered with Andre, please let us know. But I'm going to ask Jose Benitez from Prevention Point to briefly come forward and talk to us about some of the strategies that have been working. And then I want to go directly to the community representatives. It would be Cynthia Mara, Gilbert Gonzalez, Pastor Omar Fisher. And then after that, we have Brooke Feldman, Valerie Gomez, and Asteria Vivas. I don't know if they're here. Councilwoman Bass, who's the chair, who's been gracious enough to allow us all the time that we've needed, is chairwoman of this committee. The other folks that I call, if you can come forward so we can, which is Cynthia Mara, Gil Gonzalez, Pastor Omar Fisher. We'd appreciate it.
While folks are coming forward, I just wanted to, number one, apologize for being tardy this evening. But I really want to thank everyone for being here to talk about this very important issue. Again, my name is Cindy Bass. I represent the 8th District, which is in the northwest section of the city of Philadelphia. We go from Broad and Lehigh up to 66th and Broad, up to Chestnut Hill and over to 2nd and the Boulevard. So it's a lot of real estate to cover. And there's a lot of issues in all of that real estate. And this is obviously a very, very, very significant and important issue, and I just really wanted to thank everyone for being here today. We had some conversation. We need to have more conversation about this issue because it's not something that's just going to go away. We need solutions. We need to not fight each other, but work to find solutions to help each other. And for any one of us, when we look at the encampments, we could say, but for the grace of God, there go I. And so all that being said, once again, I wanted to really just say thank you to everyone who's here tonight and look forward to hearing all of your testimony. Thank you.
Thank you. Jose, you want to know your name for the record? You got to talk close to the microphone.
Sure, thank you. My name is Jose Benitez. I am the Executive Director over at Prevention Point Philadelphia. And I was just asked to talk a little bit about some of the programs that have been successful. I know it feels that we're not making progress, but there is some progress being made as we speak. One of them is that we were, with the help and support of the City Office of Homeless Services, along with CBH, along with the behavioral health system, and along with the assistance of our councilwoman, we were able to open a small, what we call a respite, 40-bed facility at the Old Village Thrift. We have been running the respite for the last 3 years. It started off with a cooperation with Project Home. We've housed in the respite throughout the years. It went from the basement of the church, 23 people, up to 40 across the street. And we've been able to place about 46% of those folks into long-term housing programs. So having this small approach and then a targeted case management approach has allowed us to place people, get them off the street into low barrier housing, and in some cases treatment and longer term housing. So that as a model has been something that has been working for us, even though we're on a small scale. Then recently we were asked to assist with an additional 40 beds that's being funded again by the Office of Homeless Services, and we hope to have an additional 40 beds up and running by May 1st. We have a medically assisted treatment, a low barrier medically assisted treatment program that we have at Prevention Point. We've been running that for the last 10 years. We recently increased our slots to 200 slots. That's within the last year. We already have 150 of those 200 slots filled. And over, I would say, close to 80% of the people that are in our medically assisted treatment slots are doing well. They're stabilized and are really working hard on their programs and are doing well at this particular point. I just think that we as a community have, it's a tough situation. It's a complex issue. So not one thing is going to sort of solve our problem. We need to have multiple approaches to what we're doing now at this particular point. And some of them have to be things that we try and see that are new, that we try and see, how we can support people so that we could get them back to stable lives and hopefully to some stable housing.
Just quickly, to Councilman Dom's point, what is the average cost, or have you figured out what the average cost is from your entry point to your long-term time and cost? And if you don't have that, if you could submit that to the panel, that would be helpful.
Yeah, I could do that. What I can tell you is that we are being supported by, our respite costs about $450,000 a year to run if we're doing it year round. And mind you that we are, it's limited, so we're not open 24/7 unless there's a weather emergency.
So,
But we can get you
so
some.
you're doing
some
the low
figures.
barrier $40 bed, not the
That-
$150 bed or $300 bed we
That's,
talked
that's
about.
correct. It comes out to about $40 to $60 a bed. That's it.
Okay, thank you.
Thank you.
Oh, Councilman Donald.
No question.
You hear me okay or no?
Yep,
Okay. So I've been up to see you, Jose. You do a great job, by the way.
thank you.
If I said to you, we have this problem on these 3 or 4 streets, Frankfurt, Kensington, Emerald, what was the other street, Councilman?
Tulip.
Tulip. What do you think the solution is?
It's going to cost us some resources. I mean, I think that's one of the pieces of it, but I think we're starting to put the pieces together, right? It's smaller respites. It's engaging people in groups, because whether we like it or not as a community, you know, and unfortunately I have to say some tough things here, which whether we like it or not as a community, the encampments have become communities. And we have to engage them in a way that's both respectful and honest to that, right? To work with people as community so that if we're, you know, we're going to try this. I think Eva sort of made mention of this in her testimony. We're trying to, we're going to try this. We're going to try to move people as a community together and then intensely work with them. But it is a resource issue because housing is a huge issue in every city in this country, right? And so it becomes difficult for us to move people down the line. And I think that's a matter of resources.
Okay, thank you. Thank you very much.
One last question. I'm sorry, just before you go, and I want to thank you for your service and what it means to the city. Part of the city's issue, I think, was now that we have to move them as a community, we allowed these communities to build and to develop, and it makes it harder for us now to address them. And I think so. What we're looking for is trying to move them as communities, but also try to make sure that they just don't have the opportunities to create new communities in different places. And I think by that, we do need enough resources to do that. We do need more beds, and understanding we're going to be opening up another respite. But we as a city are willing to come up with those additional resources to do that. Again, we have to find locations, and that's challenging. But we know that if we now have these resources, these locations for our folks to go to get assistance, we then could say, you know what, we have places for you to go, you can come here, you no longer, it's not okay to live in a tent on our streets. And we have to make sure that we give you that opportunity to get the care that you need. And I think if we do that and change our philosophy so that these communities don't build, and so that then again it becomes harder and harder for us to then say, we have to take the whole group as one, where if it's one person, we address that one person, try to get them in and say, it's okay, we have this help for you. And not everybody's going to want to go, and we know that. You have to engage some people sometimes 10, 20, 30, 50 times before they build that trust to go. But knowing that we have it available to them and that they're not going to be able just to live in that tent at that location is something that I think we need to really work on, and to make sure that the folks out there need to do that.
No, and I agree, Councilman. I appreciate the comments. I agree with that. I think it's in lots of times in my experience doing this, it's slow work because we have to develop some trust with people, and then we also, as I said, it does become a resource issue. And it's sort of trying to find different places for people to be. I constantly say to our staff, you have to have scrambled eggs over easy, omelets ready for people, because some people don't like some people won't like the scrambled eggs. They want the omelet. And we have to figure all of those kinds of menu items out in our service delivery system. And I think that that's sort of where we're headed. And this crisis has allowed us to have this conversation. I think it's you know, we can all agree it's past due time that we have this conversation, but I think the approaches are changing, and you know, it's unfortunate. I don't know if they're going to change fast enough to meet all of the need, but at least we are heading in a direction where we're listening to each other, and so I appreciate that. Thank you.
Thank you.
My name is Cynthia Mara. I've been a long-time resident in this area. I attended Conwell Middle Magnet School and graduated from Kensington High School. And despite what I saw growing up and the dangers I remembered, it didn't dissuade me from wanting to own a home in the community I called home. But now that I have children, a 2- and a 4-year-old, I've been painfully reminded of the trauma and the memories of heroin users that wouldn't allow me to walk to school safely alone, or the sight of mountains of needles in my favorite neighborhood library, McPherson Square. So you can imagine the disbelief that I and those in my community had when it had been announced that a pilot for a safe injection site was approved in the January 22nd, 2018 report on exploratory site visits for comprehensive user engagement sites by the City of Philadelphia. A mouthful, to say the least, that doesn't help our community members understand what it means. This approval has been the subject of much controversy because our community has been plagued by the opioid crisis for decades. This community of Kensington, predominantly a Latino community, has suffered for far too long, and our voices have not been heard. We, the residents of Kensington and citizens of Philadelphia County, do not believe that adding a safe injection site within an existing drug hub will make matters better for our children, for our families, or for the opioid user community who need effective treatment. Instead, we feel that it will further deteriorate our community, continue negatively impacting our quality of life, and serve as a reminder that those who break the law and are not from Philadelphia are a more important constituent than the thousands of tax-paying residents who fear for their safety and livelihood every day. The City of Philadelphia. The City of Philadelphia has neglected Kensington for decades, allowing drug usage to flourish. Now there was a desire to clean up Gurney Street due to the area's gentrification and force Kensington residents to deal with this alone. The widest misconception that this administration and those in favor of a safe injection site spread is the false idea that we, the residents, do not want to save lives, and that we are by default wasting lives by having this conversation. This hostility is what angers us, and it is not the way to have these conversations. If we are beyond the point of conversation, then it is only because there were people in power who never wanted to have it until it started to impact the city's cash flow. We've been having these conversations, and we're the ones whose families experience the daily trauma of seeing users in the throes of addiction. We're the ones who witness this every day. And the communities and local counties that they come from don't have to deal with the problem either, and we need to be very transparent that we have a community of predominantly white users and one of the most concentrated Latino communities in the United States. We have been dealing with the proliferation of trash encampments and drug use in front of our schools and overdoses in front of our homes. Families are moving out of their long-term homes that they own to rent elsewhere. And now, fentanyl-laced heroin, or fentanyl-laced cocaine disguised as heroin, causes death for those who take it. And we want to know, why is this being approved to be taken at a site in our neighborhood where our children live and breathe? There has been no mention of how to protect the residents of the community who have been endangered by rampant drug use near our churches, schools like Visitation and H.A. Brown, and daycare facilities. As a community, we've suffered enough, and now the City of Philadelphia wants our families to endure this even longer. With the safe injection sites, there are recommendations to continue to put the safety of the user first, without full consideration of the inherent risk that the community faces in being primed as a location for the safe injection site. And when you say this is best for saving lives, you're not including our lives. You're not thinking about me and what I experienced growing up. You're not thinking about my children who will be exposed to this as long as we live here, and you're not spreading the responsibility to the counties whose residents come to Philadelphia and become addicts and are honest about where the majority of our users are coming from. And you have not helped users as a community access treatment, care, and housing because you are too focused on one solution as opposed to thinking holistically about this community. You have not solved the first problem you created of the encampments by cleaning Gurney Street. And while I am deeply concerned about the lives of those who are at risk and overdosing while they're in the throes of a powerful addiction, I cannot prioritize the ravenousness of addiction by enabling it over the lives and safety of our families, our children, and allow them to experience the freedom to live a normal life in their neighborhood. Thank you.
Hi, I'm sorry, I should have gave the ground rules. We are going to do 3 minutes.
Okay.
I know Cynthia came with her stuff written, but
I'll be real quick.
He'll notify you.
Okay, you got me? Okay, so I'm just going to give you what it's like in a day here in Kensington. My name is Alberto Gonzalez. I work at Community College of Philadelphia. I take my son to school, and there are free drug giveaways, and these people with opiate epidemics are running through the children. This is happening at Conwell Middle School. I call the police, the security guard calls the cops, they never come, and we're rushing the kids into the schoolyard. Meanwhile, the drug dealing is happening right there. It's free drugs, they're given away to these people. On another day, my son is sick, and they question me. I show my ID, they say, who are you here to pick up, all this other information. I'm in the school. At that time, I didn't know that there was a guy behind me with opiate issues. So he buzzes in and he says, I'm here to pick up Lucas Gonzalez. Don't let his father, Gilbert Gonzalez, take him, because his mother just called me. I'm here to pick him up. Right? So I said, call the cops. And they said their response was, well, this happens all the time, and it's not our problem because it's happening outside the school. Okay? Today, there was a shootout at Clementine, early in the morning as we're dropping off our son. This is a day.
Thank you. I'm going to call the next panel. I'm trying to get through the list of folks who missed out at the last one. So I have Brooke Feldman, Asteria Vives. I know Raymond Cruz turned in something in writing. Oh, Vanessa Baker, I'm sorry. If you all can proceed. I'm gonna keep moving along then. Vanessa Baker, Evan Figueroa Vargas. I thought I saw Evan. Oh, Brooke, there it goes. Okay. We're gonna try to abide by the 3-minute rule. We have 30 people that pre-registered and another 30 on site. So, thank you. Brooke was first, Vanessa, and then Evan. We have you wrote a pretty in-depth testimony that was in writing, so.
All right, so thank you, City Council. Thank you for having me. I apologize for my attire. I was down at one of the encampments, making sure that the folks down there could hear what was happening here tonight, and so they were listening intently. So my name is Brooke Feldman. In 1993, my mother, Marcia Holman, was found dead in her Kensington home from a fatal heroin overdose. As a child, I couldn't understand why my mother would choose to use drugs over being a mom. I certainly couldn't understand why she would choose to do something that would ultimately end her life. It wasn't until I developed my own challenges as an adolescent with mental illness and addiction that I would understand more than I ever wanted to how addiction wasn't a choice that my mom made. My mom didn't choose to develop mental health challenges and a substance use disorder, and neither did I. I spent my adolescent years in and out of Philadelphia's behavioral health and juvenile justice system. At one point, I was told by a psychiatrist that I would likely be institutionalized for the rest of my life. Not only did I have very little hope for my future, but it seemed like my family and the system didn't have much hope for me either. By the age of 23, I had a full-blown opioid use disorder. I found myself having become the very thing I swore I would never become, as my body screened for opioids each morning as soon as I woke up, and with the daily decision present of either finding a way to use opioids to alleviate the pain, or just end my life once and for all to end the pain for good. I realized that I had in fact become just like my mom. There was no denying anymore that I too was what we call an addict, and I knew I needed help. For me, I was one of the lucky ones. Although having access to recovery should never be about luck. In 2005, as an unemployed Philadelphian with a full-blown opioid use disorder, I was able to receive public assistance and was met with an open door into treatment and recovery housing, the latter of which was funded by the Office of Addiction Services for a 9-month stay, a length of stay that is absolutely unheard of in today's system, yet was likely the difference between my sustained long-term recovery or returning to using drugs. Also, I was the recipient of a favor called in by the recovery house manager who saw something in me when I showed up for help. It is not lost on me that had I showed up with a different color of skin, would a white woman who didn't know me have been so able to see something in me and so willing to call in a favor. It is also not lost on me that Philly's system should not, to this day, most often require knowing somebody who knows somebody who knows somebody who can get them what they need. Access to recovery shouldn't be about luck, it shouldn't be about privilege, and it shouldn't be about having connections to the right people. I have spent the majority of the past 13 years of my recovery giving back and paying it forward in a variety of roles throughout Philly's system. I've worked in recovery housing, treatment, a recovery communities organization, the Department of Behavioral Health. I've also obtained my bachelor's degree in social work and will graduate from Penn. Now I'll graduate from Penn with a master's in social work degree in, I believe, 41 days. And I lost my place. They don't teach you that at Penn. Yeah. Me going from being locked up in handcuffs and shackles, blocks away in the juvenile justice system to graduating from Penn is a testament that recovery is absolutely possible. My recovery wasn't made possible, though, by something amazing about me. There's nothing amazing and special about me. It really was made possible by having access to the resources and support I needed when I needed them and for how long I needed them. When I look at how my recovery has benefited not only me, but my family, my community, my city, and beyond, it is clear that recovery must be made possible for everybody. One person's recovery ripples out and positively impacts all those around them. We all benefit when someone has a chance to find recovery. We have long had an addiction crisis in Philadelphia. It didn't start with opioids. We have long had this. We have long had a behavioral health system in need of dire improvement, one that doesn't require luck or that isn't perfectly designed to only work for some. While our system has made great progress over the past decade, much progress remains to be made. Some key changes that must be made are on-demand treatment access.
Brooke, I'm going to ask you to sum it up.
So our system.
Your stuff is all on the record. It was really nicely written up. So
Thank you.
I appreciate it.
Thank you.
Okay, Astrid is next. It's in the waiting room. Asteria is next, then Vanessa, and then Evan.
Do I stay here?
Yeah, you can stay there. We're going to try to honor the 3-minute, please.
Buenas noches. Amen to all those successful. What I basically want to focus on is recommendations based on my experience. I've been out in the street and
You got to put your name for the record.
Asteria Vives, Home Quarters and Friends, community activist, also with the 25th Police District Advisory Council. Based on my experience in just assisting many in different areas to include clothing, feeding, guiding them to detox, and programs even outside of Philadelphia. I've gone as far as even going to the morgue, so it's been very touching. So at this point, the only thing I can do is recommend based on my experience with those, because they also end up being, a lot of them end up being like your family too. But when you do have this safe injection facility, it is important to educate those of what it is about. But also, families really need to be involved. Families of those, and I'm willing to be one of those, to be knocking at the doors to share the importance of getting involved in recovery, because my hope is that when they are there, that they are guided to recovery, to detox and recovery. My concern is that, as you know, that many that want recovery, if they have a partner that doesn't, it fails. So in the facility, it would be nice to have a separate room and a separate exit. So if I say, for example, if I'm an addict and I say I want recovery, I go into that room and I exit somewhere else. I don't exit in the same entrance that everyone else is coming, because they're only going to encourage me to remain, because some of them are there to inject themselves. Some of them do want help, not everyone, and this is a reality. So it's that recommended. As well as recommended is educated, certified, and community-based pastors. Because of the past experience of having fake pastors and wannabe directors and stealing identities and their access card and opening up accounts and using their funds and treating them bad, they lost faith. So we really need to bring in pastors that truly do care and truly do love. And please remember that if we don't resolve these issues of those that did steal their identity and treated them bad, they, in their mind, how is anything going to be resolved if that hasn't been resolved? I just personally believe that these directors and pastors that stole their identity and used their money and opened up separate accounts, even with utilities, need to be prosecuted. Thank you.
Thank you.
Hello, my name is Vanessa Baker, and I'm here as both a neighbor in Port Richmond in Squillis District, as well as a person in long-term recovery from heroin addiction. I'm an educator now, a privilege that I attribute to having been given a lot of get-out-of-jail-free cards due to the color of my skin. And in my active addiction, I drove away from police officers when they tried to pull me over many times and never thought about getting shot at, in the same neighborhood in Baltimore where Freddie Gray was killed. I tell this story to put a face on the wider story of the racist policies and practices of the war on drugs, which included harsher sentences for crack cocaine than powder cocaine. This is why when opening a comprehensive user engagement site, we need to demand that it be truly comprehensive. It needs to be open to users of all drugs, and not just heroin. We cannot allow a government-sanctioned safe zone to be created which will only protect users of heroin who are majority white from arrest and overdose. We also cannot allow powerful institutions with vast resources to use the suffering of people living under bridges in squalor in order to further their own exploitative agendas at the expense of the best interests of the people being served. People need housing in order to get clean. And it is unacceptable that more action is being developed around how to use homeless people as lab rats for Penn's latest data mining venture than to get them into housing. There is literally no plan from the city to house all of the homeless people in Kensington, but if you check out Penn's website and search for its article about the Leonard Davis Institute grant, which will be used for researching a SIF, you'll see Penn is very busy using this horrific situation to create networking opportunities and future grants and career boosts for privileged Penn people. It would be easy to miss the sentence in which the 1,200 deaths Philly saw last year is mentioned in the article. They are busy building a headset that a heroin user can put on as they go off to shoot up alone, as if the solution to the problem were to just hand users some surveillance technology without changing any of the circumstances that led to addiction. The person who is designing the headset has already said Penn doesn't have pockets deep enough to help pay for housing. I call BS. Penn has a $12 billion endowment, and it doesn't even pay taxes. And the Soros Foundation has already sponsored research on SIFs that concludes, and I quote, government agencies can repurpose their funding to community harm reduction activities that achieve desirable social outcomes. through issuing social impact bonds. In other words, the government can use its money towards ends that investors, not community members, not substance users or healthcare professionals deem to be desirable social outcomes, and which conveniently make a profit for those same investors through data harvesting poor people with little to no say in the matter. And Penn has not one but two centers for social impact investing and behavioral economics. They have no accountability to the community, and when they get their resume bullets from this and move back to the main line, we as a community are still going to be dealing with this. 1,200 overdose deaths is all the data that I need to know that we need to do something to address the problem. We have the research from Vancouver, we need a safe consumption site, and we need housing now.
Good evening, Council Chair Cindy Bass, Vice Chair Maria Quinones Sanchez, members of the Committee on Public Health and Human Services. I am Evan Figueroa Vargas, a person with lived experience and long-term recovery from mental health and substance use disorders. I am also a family member of someone who has died as a result of an opiate overdose. For the last 4 years, I've had the honor and privilege to serve Philadelphians experiencing homelessness, mental health, and substance use challenges in my capacity as a peer-to-peer mobile homeless services program manager at Mental Health Partnerships, formerly known as the Mental Health Association Southeastern Pennsylvania. Finally, I'm grateful to the City of Philadelphia and to my employer, MHP, for providing me the opportunity and flexibility to serve on the Mayor's Task Force to combat the opiate epidemic in Philadelphia, convened in 2017. Thank you for this opportunity to testify in response to Resolution number 180037. I want to talk a little bit about my brother, Luis Figueroa Vargas, who died of an opiate overdose. Luis Figueroa Vargas was somebody who was loved by his family, friends, and others who had the opportunity to meet someone with such a big heart for caring and giving to others. Unfortunately, my brother Luis struggled with crack cocaine in the late 1980s, 90s, and early 2000s. After many failed attempts at recovery, my brother landed in jail where he picked up an opiate habit. I'm gonna say that once again. My brother picked up an opiate habit in jail for those of us who think we can arrest our way out of this problem. Unfortunately, on January 1st, 2002, Luis died at my parents' house on the first floor while my parents slept. Today, I wonder how a comprehensive user engagement site, better known as a safe injection site, and other recommendations made by the Mayor's Opiate Task Force could have helped change the trajectory of my brother's life and struggle with his opiate addiction. No one, again, no one should have to experience the loss of a sibling as a result of a preventable death. I'm gonna say that one more time. An opiate drug overdose death is a preventable death. No mother should wake up and walk downstairs to find their son died on the couch. While it could be argued that my brother was not ready to seek or sustain his recovery from his drug addiction, every day I push back in my heart and head, knowing that and believing that a comprehensive use engagement site, again, better known as a safe injection site, proposed could have kept him alive long enough until he was able and willing to sustain recovery. Also, I would like to add that treating addiction with old ideas, interventions, my way or the highway, and plain old tough love does not work in a world where heroin and other drugs are being laced with carfentanil and fentanyl. In my recovery, I saw for treatment options with help with my addiction and mental illness. It was not until I was arrested that I was able to get the help that I needed. Had it not been for the intervention in the prison and afterwards, my addiction may have progressed like Luis, and I would have been dead rather than testify here today with the power of community support, CBH and DBH funded services. Providing CBH-funded peer-to-peer evidence-based services in the city of Philadelphia over the past 4 years has enriched my understanding of those struggling with physiological distress, mental health conditions, and substance use. What I have learned the most is that people are more than their diagnosis and their struggles with substance use. Like my brother Luis, people who struggle with these conditions that I have mentioned have a name, a family, friends, talents to share with the world when they provide the appropriate supports and resources to not only recover, but to thrive in recovery. A critical key to recovery is community-based supports and peer-to-peer programs. Certified peer specialists who truly meet people where they are in their recovery, even when that means that people are just not ready to recover. People just, even when that means that people...
Evan, I need you to wrap up.
Okay, I will.
There's a lot of
Okay,
folks
in
who
summary,
have a
I am the
forum.
evidence that people can and do recover from substance use challenges. People like me and so many others that I have the honor and privilege of meeting through my work at MHP prove that we just don't recover, but that we thrive in recovery. My story of succeeding is not unique. In fact, through my work at Peer Homeless Specialty Program, I have witnessed many success stories. People who one day experienced chronically homelessness, psychological distress, mental health conditions, substance use, counted out and considered as a nuisance by many in society of today's advocates. Thus, here I am, Evan. Business owners, college graduates, exceptional employees, parents, siblings, neighbors. Society's most significant resource is human potential. Please do not allow someone to cease to exist
Evan?
because they are struggling with the disease of addiction. Say yes to comprehensive user engagement sites. Thank you.
Thank you. All right, I'm going to call the next witness. I'm going to ask folks to really honor the time, especially those of you who are very vocal and have a lot of other forums to talk. We want to get through as many of the folks on the list. So thank you to our panel.
Thank you.
Carla Safransky, Matt Tice, and John Cooper. These were all folks that were registered. This is the end of the list of the folks that were previously registered. We're going to go to the pre-registration list before we even go to anyone who registered today. If folks honor the time, we'll get through it. After that, I'm going to ask for Brother Ramon Razan, Tyler Hurst, William Diaz, and Pastor Billy Cortez. Proceed. We want to acknowledge Councilwoman Helen Gim has joined us. Thank you, Councilwoman.
Good evening. My name is Matt Tice. I'm the clinical director with Pathways to Housing, a nonprofit organization here in Philly. I was privileged to be a member of the task force that we've mentioned before. At Pathways to Housing, we exclusively serve individuals who are experiencing chronic homelessness. So they also have to be diagnosed with severe mental health diagnoses or severe substance use disorders. Many times they pass through other programs who have not been properly equipped to deal with the severity of their need. Through our robust litany of services, we can make serious impacts on a small group of individuals with those needs. Homelessness clearly leads to poor health. When you're on the street, you often don't know where to turn for medications, storing meds, maintaining a routine that allows you to make doctor's appointments, safely recover from significant procedures, or many other needs. It's especially difficult to make steps from major addiction while also dealing with the continual frenzied trauma of homelessness as well. Our intervention, with its low barriers and rich menu of options, gives people a fighting chance for treatment if they're interested in it, where previously often they had nothing but their will to survive.
We're going to ask the folks by the door, please, if you could be respectful. Take the conversation outside, please. Thank you.
We use the housing first model, which means giving someone an apartment with no other preconditions, but then immediately upon acceptance into the program, a multidisciplinary team with social workers, a nurse, psychiatrist, medical providers, certified peer specialists, and other case managers spring into action to help keep that person stable in their home. In the fall of 2016, several departments of Office of Homeless Services, Department of Behavioral Health, and CBH recognized the confluence of chronic homelessness with severe opioid addiction, especially in Kensington. As a result, we developed a specialized clinical team designed to support individuals with severe opioid use disorder move from the streets into stable housing and further wholeness. We recognize that this is an innovation where almost no one else on the continent was doing what we wanted to do. Give those with severe heroin addiction apartments with no preconditions for treatment. We knew we had to do something. This team featured 75 of some of the most vulnerable and long-standing individuals who had been on the street at the time. Over the span of offering this intervention, we've been able to help 50% of our participants transition from severe opioid addiction into accessing medically assisted treatment. This is done without requiring participants to enroll in any treatment and as a condition for their housing, unless they choose to do so themselves. Housing First is a best practice. It's evidence-based approach recognized by HUD and SAMHSA. On the clinical team serving individuals with opioid dependence, we have 100% housing retention rate. While we see extremely high rates of hepatitis C, HIV among the groups, we're also helping them get connected to care in ways that we have never engaged with prior to housing. Individuals in our program experience drastic reductions to their access to emergency services, for health or behavioral health, incarceration rates, and inpatient stays. We think that this is a great program. We really appreciate the opportunity to be able to continue to expand. I think that it's really, really helpful for the folks that are transitioning from the street.
Thank you.
Hello, Council. My name is John Cooper. I'm Director of Self-Help Movement. I'm Program Director of a 120-bed Department of Corrections wing. I was on the Mayor's Task Force. I work in the field. I'm in the trenches every day, and I say that not to boast, but I'm also 17 and a half years away recovering from a 15-year heroin addiction. I didn't read this stuff in the book, and one of the most intimidating things that I went in my life when I was appointed to the Mayor's Task Force, you know, I got my GED in federal prison. I was born in Episcopal Hospital, went to visitation, and went to North Catholic. I'm a neighborhood kid. You know what I mean? The thing that I want to focus on, because there's a million things I can talk about and a million things that I can say about what's wrong, but I think the most important in access to treatment, what we're missing right now, what is being taken away from our children is a choice. We're no longer being given a choice, we're being remanded to a certain type of treatment. And understand this, I am not against anything that works for anyone. But I think that when choice is taken, people are denied treatment because they don't want to accept the first recommendation for treatment, I think is a crime within itself. And those children are put back on the street and then represent and hope that they can get access. I work in the community outreach. I take, and this is not to boast, but I take multiple phone calls, multiple mothers telling me whose children are in crisis on MAT treatment, supplementing with benzodiazepine, and their children seeking emergency treatment and denied because they're on existing level of care. And the next phone call I get from that mother is from the 25th District, whose child was found in an overgrown lot in North Philadelphia. We need choice. I respect what you had to say about, you know, we know what's going on. What are we doing towards? Are we putting our best efforts? But in order for us to make change, we need to look inside ourselves. And the way that the access to treatment is being run and utilized, and the denial of treatment, how much of a part in the opioid overdose death does that play? But no, we don't want to look in our own house. We want to sit on top of the hill and recognize that everything's good up here because we can read statistics, because we can look at a chart. But we're on the front lines. We see what happens every day. We see these mothers, these fathers, these children, these aunts, these uncles. We see what the denial and the access to treatment causes families in these communities. I don't have all the answers. And everyone that I talk to say it's a broken system, but it's our system. But unless we can start to have accountability to these providers, because I'm so proud of the institution that I work for, because we go from everything from GED, case management, job search, access to computer labs, access to everything, and we do it for probably about 60% less than the going per diems. So there is no excuse with resources. We need more resources. I'm not going to say that, but we need accountability to those that serve us.
Thank you. As I said, the next group is Brother Ramon Razon, Tyler Hurst, William Diaz, and Pastor Billy Cortez. After that, we have a representative from Somerset Neighbors, Shannon Farrell, Dan Martino, and Gillen Escavil. Proceed.
Good evening, Council. I'm Brother Ramon Razon, OFM, Franciscan Friar at St. Francis Inn, 2441 Kensington Avenue. There in our dining room, we serve meals 365 days a year, year in, year out, to many of our Kensington neighbors with and without homes. Based on our collective encounters with our guests at St. Francis Inn, who suffer from the illness of substance abuse or addiction, a comprehensive approach is much needed to address this complex epidemic at this point. At the trenches, we cannot deny the regular incidences of some of our guests who overdose and shoot their choice of substance on our streets, and occasionally even in our campus. In and of our campus, we face similar concerns as our neighbors. Finding needles on our pavements and street corners, we strongly advocate for prevention, rehabilitation, and treatment. But on the ground, we find that the reality is different. Our needs on the ground forces us to also focus on harm reduction. Harm reduction treats the opioid epidemic as it is, on the basis of its nature as an illness, and in reality, a human problem needing humane solutions that are not always simple. Prevention and treatment obviously are not enough, since this epidemic has not ceased in the lives of the many people we serve. Just the other week, John Stevenson's body was found at some location on Tulip. We know him personally. He comes to us for his meals. Research after research, apart from our ground experience, already reveal that treatment hinges upon the readiness of an individual suffering from substance use. Over time, we've seen the use of alcohol, heroin, cocaine, and now fentanyl and carfentanil terminated only when consistent and comprehensive support is provided to users, and more importantly, while they are still alive. We are aware that the issue of cues is controversial, but we invite our neighbors and leaders to treat the presence of cues as the first step to empower individuals who suffer from the opioid epidemic, and to offer them the choice to be safe even for another day, to make another choice that's beneficial for them. Cues, as we know, will also include services that provide access beyond substance use, and they ought to be treated as opportunities to lasting solutions. Please let us continue with the conversation, but let us not terminate the conversation based on our limited concerns and fears that the epidemic will just infiltrate our neighborhoods. It is already a crisis in Kensington and will only proliferate further if we do not address it immediately. We've been serving meals every day nonstop in Kensington for more than 30 years now, because we value the dignity of every human being who comes to our doors. And so, on behalf of many of our guests suffering from this epidemic, we appeal for support both for prevention, treatment, as well as harm reduction.
Hello, council members, and thank you very much for having this meeting tonight. My name is Tyler Hurst, and I'm a social worker in Philadelphia. I've been in the field for about 7 years now, working across all different levels of care in substance use, trauma, and mental health. I've been fighting this problem in the entirety of my 7 years in this field, from the front lines as well. And I'm also a person in long-term recovery from substance use disorders. I'd like to say, where has everyone been? I've been an advocate in this arena for years, and we have been advocating and fighting for the resources that are just now being talked about, only because everybody is coming here together tonight because of the threat of a safe injection facility being put into the community. And for years, we've watched the number of overdose deaths in this city climb higher and higher and higher, and only until now have we started talking about doing anything about it. I'd like to say thank you to the Mayor's Task Force and for the recommendations that are provided. Using city money to take care of that is something that I, as a taxpayer, appreciate greatly. But I'd also like to say that if that's what it takes to get all of us to the table, then we need to reevaluate the way that we're looking at the epidemic in this city. As a social worker, I've worked in one of the crisis response centers in the city, and I've treated and met with people who are just coming into the door for help. And more often than not, these people are told that they aren't going to get access to a level of care that they need. All the research in our fields purports that people need longer lengths of stay in care to be able to get clean and get sober. But for a person who's facing opioid addiction, more often than not, people are only recommended outpatient treatment or medical-assisted treatment, when what they're really in need of is long-term care and inpatient. We don't have enough of those beds to go around. Thank you for addressing that in the beginning of this meeting. However, again, I go back to the point of where were you when we were asking for more money for the 21st Century Cures Act? Where was everybody when we were asking for money for the addiction or Comprehensive Addiction and Recovery Act? And when those bills got lip service and no money was brought to recovery, we continued to talk. And now we're here today only because people are talking about implementing something that may save lives. And yes, I understand to the people of the community of Kensington, I do understand how you would be apprehensive about this. But I do just want to say that all the research surrounding the 100+ safe injection facilities across the country supports that they reduce crime, they lower the amounts of needles that are seen in open areas, and they reduce communicable diseases in and around the greater area that they're implemented. So if we look to the research and we look to science, which is something that we should have been doing from the get-go, we'll already see what the rest of the world has seen in the 100 other sites that are implemented in multiple countries across our planet, but we, for some reason, have dragged our feet on. I'll finish up by saying, in one of the earlier community meetings, just on Monday actually, a police officer from Canada told me that he was made fun of by the people that he worked with when he arrested drug users. Why are we not implementing the same policy and policing across our areas? And where has the police and the DA been in these meetings across the city? Why are they not being part of it? So thank you for your time.
Muy buenas noches.
Good evening.
Voy a utilizar mi primer lenguaje, que es español.
I'm going to use my first language, is Spanish.
Mi nombre es Pastor Billy Cortés.
His name is Pastor Billy Cortés.
Ahora cumplimos 4 años trabajando lo que es la área de Front y Somerset.
It's going to be 4 years they've been working on intersection of Front and Somerset.
Y voy a ser muy rápido y muy breve.
I'm going to be very brief.
Porque estamos navegando en el mismo problema y no se está encontrando una solución viable.
We're navigating the same problem, but no resolution has come up.
Se está tratando de inventar más soluciones, la cual ya las soluciones están en la mesa.
We're trying to navigate saying the solutions, but it's already on the table.
Cuando nosotros comenzamos a trabajar en el área de Front y Somerset,
When we started working in the intersection of Front and Somerset,
la primera persona que nosotros contactamos fue la concejal María Quiñones.
the very first person that we contacted was Councilwoman Maria Quiñones.
Nunca le pedimos un centavo para poder liberar la comunidad de la droga.
We never asked 1 cent from her to try to alleviate the problem.
Utilizamos los recursos viables que ya estaban funcionando.
We were using the same solution that she had suggested.
Aquí hay un gran problema y es que se están tratando de pasar la papa caliente de mano en mano.
Where we have the problem of passing the hot potato to one
Y
another.
aquí lo responsable de todo este problema ha sido CBH.
The problem that it has is CBH.
Porque CBH habla que hay que multar la farmacéutica y hay que multar las clínicas de salud mental, pero quien está pagando por los medicamentos son ellos.
The person that is causing this problem is them.
Ellos son los que han estado pagando por este medicamento año tras año, año tras año.
They've been paying this year after year.
Pero yo no sé por qué la gente tiene miedo de hablar lo que tiene que hablar.
I'm wondering why people are afraid to talk this topic.
No se habla de reformar el sistema de prisiones.
They're not talking about reformation of the prisons.
Si tú te pones a buscar cada persona de esta, todos han pasado por la prisión.
If you look at every individual, they went through the prison system.
La prisión es lo mismo que la calle.
The prison system is the same as the street.
Con lo único que no puede salir a la libre comunidad.
The only thing, they don't have the freedom to come out.
Ellos tienen droga adentro.
They have drugs in the prison.
Ellos tienen alcohol adentro.
They have alcohol in the
Ellos
prison.
tienen de todo adentro.
They have everything in the prison.
¿Qué está pasando con el departamento de Probation Office?
What's happened with the probation office?
Todos ellos pasan por ese departamento.
They go through that office.
¿Y qué está pasando con ellos?
What's happening with them?
Yo creo que se está invirtiendo dinero equivocadamente.
I think they're investing their problem.
Ese dinero está saliendo de toda esta gente.
They're coming out of their pockets.
De los que se levantan a las 5 de la mañana para ir a trabajar.
Those who are waking up at 5 o'clock
Se le ha estado faltando el respeto a los niños.
They're disrespecting
Se le
the
está
children.
faltando el respeto a la policía.
They're disrespecting the police.
Que ellos se levantan día y noche para poder salvaguardar nuestras comunidades.
They wake up every morning to protect our
¿Por qué no
community.
se habla de darle dinero a a ellos?
Why not giving money to them?
¿Por qué no se le pone el equipo correcto a ellos?
Why you don't give them the tools they need?
Si no hay drug dealers, no hay droga.
If there's no drug dealers, there's no
Y si
drugs.
no hay droga, no hay adictos.
If there's no drugs, there's no
¿Por
addiction.
qué tenemos que seguir inventando?
Why we continue inventing?
Cuando la solución ha estado en la mesa año tras año.
The solution has been there for
¿O
years.
es que esto es un negocio para alguien?
Or this is a
¿Quién
business
es
for
el que se
somebody.
está lucrando de esto ahora mismo?
Who is benefiting from this?
Para eso es que ustedes están en esa mesa.
That's why you're in this table.
Para contestarnos a nosotros esas preguntas.
To answer those questions.
Porque cada persona que es electa en la ciudad
All these people in this
son
country,
nuestros empleados.
they are our employees.
Trabajan para nosotros.
They work for
Y
us.
tienen que salvaguardar nuestros derechos.
They need to hear our.
Porque se levanta un grupito de derechos civiles.
If a group will rise up,
Esos son los que están defendiendo a esta gente.
the other one defending them.
Nosotros queremos que haya una solución y es ya.
We want a solution.
Y
That's
nosotros queremos ver en mayo que no haya más campamentos en ninguno de esos bloques.
We don't want no more encampment in those
Queremos
spots.
que se libere la comunidad porque
We want
esto
this free.
tiene a nuestros niños
They have
en
these
una
children
prisión.
in prison.
Y en nuestras reuniones niños llegaron diciendo
Some of the children
que a
have
los
come to
7
community.
años, tú sabes que un hijo de 7 años decirte yo me siento preso en mi casa.
You know that child saying 7 years old, I feel like I'm a prisoner in my own home.
¿Ustedes tienen hijos?
You have children?
Pues nosotros también tenemos hijos y nietos.
We have children also.
Y a los 7 años ellos se sienten presos en nuestras comunidades.
They're 7-year-old and they feel prison in
Y
their
esto
own
no es justo.
And that's not right.
Aquí no hay que buscar más dinero.
We don't need more money.
Aquí hay que usar las oficinas que ya están hechas
We have the resources here
para lidiar con este problema.
to fix this
Que
problem.
Dios me los bendiga.
God bless you.
Did a drop mic on us. He did a drop mic on us. We skipped over Elise Schiller, and then we want to move quickly to someone from Somerset. Is that going to be you? Okay, so Gloria Cartagena from Somerset, Shannon Farrell, and Dan Martino. Ahora. We're going to ask folks to really try to honor the 3 minutes, please. We still have about 30 people, so please.
Thank you for allowing me to speak. Is this
Your
on?
name for the record.
My name is Elise Schiller, and I'm here for 2 reasons. 1, I was on the task force, and 2, my daughter, Jonna Natali, died in 2014 of an overdose. So I want a face to the problem. First, I want to say that I sat through the other hearing, and I was surprised, frankly, by some of the questions that were put to the commissioners that seemed to me to be quite elementary in nature. And I want to say to you that if 1,200 people died last year from this, you need to be as well-versed as possible about this epidemic. Commissioner Farley had pointed out that this was the worst public health problem in 100 years. That means since the 1918 flu pandemic. So, you know, if 1,200 people had died in the city last year from murder or pedestrian and traffic accidents, or even 10% had died from measles, we would be flipping out. And I can only assume that part of the reason the response has been somewhat nonchalant and there isn't as much education is because of stigma. And I want to say that I don't accept stigma about my daughter or related to her death. She was more than an addict. I want to say that in 2012 and 2013, my daughter was treated in 6 residential facilities, 3 IOPs, and 1 PHP. And in not one of those places was she ever given medication-assisted treatment or offered medication-assisted treatment. And in every parent conference and family therapy session that I was in, it was never discussed. I didn't even know what it was. Now we look back and we know that that was the gold standard. Now, she died in a treatment facility, 6 months abstinent. I don't know that OUD never would have killed her, but she would not have died that day if she had been on medication-assisted treatment. I don't want us to look back 5 years hence and say, oh man, we lost a lot of lives because we didn't look at the research globally about the cues. I have a lot of sympathy for the problems in the community. I'm a lifelong resident of Germantown. I live at Mannheim and Pulaski. I was born in Germantown Hospital. I know our community has a lot of issues as well. But I think we can find a way to use evidence-based solutions that save lives and rebuild our communities at the same time.
Can you wrap up for us, please?
Yes. The other most important point I want to make is about co-occurring disorders. We are doing a really bad job of treating people with mental illnesses who also have addiction. Very bad job. That needs to be a focus. I understand that all of this costs a lot of money, but we need to find the resources to do this the right way. Thank you.
Gloria? I'm sorry.
Good evening, everyone. Hello, my name is Gloria Cartagena, and I'm here representing Summer State Neighbors for Better Living, or SMBL for short. SMBL exists to make our neighborhoods a safe place to live, work, and play. We support strong families and a strong community. This drug crisis is hitting us hard. Most people in our community have lost a friend, family member, or neighbor to this disease. Many of people are still actively addicted, and many of them are among the homeless. Some are among the dead. Our families understand the pain of living with someone who is addicted and support your efforts to prevent and cure this disease. However, as a community group, we also comprehend the crisis that is creating in our neighborhood. This is a shadow crisis in our community of crime, pollution, and chronic stress. The Mayor's Task Force Plan includes 18 action items for those suffering from addiction, but it includes 0 items that are directly address families, community, and we are suffering. We are talking about saving lives, but not just the lives of those in active addiction. Because we live in this community, we have to look around and ask ourselves how many children will suffer chronic health problems because there are no needle-free parks to play in. How many of our community's children will have their own lives swallowed up by addiction and drug dealing that surround us? How many businesses will take their jobs elsewhere, leaving abandoned stores and unemployment? How many years of our community lives will be stolen by chronic stress? For those of us living in the shadow of the opiate market, there is no task force and no city plan. Our community is facing a health and safety crisis, and the city of Philadelphia is not helping us. How can we help you understand what we live here is living like? City representatives come to our meetings and say there is homelessness everywhere. There is addiction everywhere. Our residents know that. It is different here. There are so many dangers and issues we face, and we deal with them every single day. In your copy of written testimony, you'll also find a copy of this, our SMBL neighborhood bingo card. It includes things like picking up human feces, administrating Narcan, picking up needles, and being offered drugs. This is a game that my neighbors and I are losing every single day. You know that we have toxic trash all over our sidewalks. You know that none of our parks are safe, and you know that it is destroying the health of our community and our children. But you are not taking serious action. This needs to end. We don't know how to fix this issue. We need is all of you and everyone who works for you to say to our neighbors, I will not rest until you can use your sidewalks, parks, transit stops again. Our city will not rest until you feel safe walking to school, work, community meetings, and we will work on behalf to provide access to basic city services every single day. I will listen to the concerns of your community and make them my concerns. Thank you.
Danny? Dan?
Hi, my name is Dan Martino, representing the Old Richmond Civic Association. Just going to speak candidly about what we deal with on a regular basis. I feel like there's a tremendous weight in the city right now, and it's palpable. There's so many people that I talk to every day that are just afraid, that don't recognize their own city anymore. They're afraid to walk outside of their house. They're afraid to let their children go to the park, as we were talking about here. And that's unacceptable. Just as council, I would be flipping out. We're flipping out. We're 100% flipping out. So we talk about a little bit of the anger that I see on a regular basis as well. I know some of you guys know that I manage a town watch. Part of the reason why I started that was because I could see this resentment, this bubbling up anger that was happening both in my neighborhood and in the city, and I wanted to find a way to be able to manage that with compassion and understanding and reason, rather than just be a force for, a bully. And in my work and doing that, I've met a lot of people that are on both sides of this issue. I've talked to people that are living under bridges. I've talked to people that don't want to see them anymore. I've walked out front of my house to find syringes. There's Suboxone wrappers, there's syringe wrappers blowing around our neighborhoods every single day. And I don't know what to tell people anymore when they ask me what's going on, what's the city doing, what's happening with, like years ago, Emerald City was a problem. Now it's Kensington and Frankfurt and Tulip, and what's next? When does it end? I don't have answers anymore. And I don't blame them when they're angry. I don't blame them when they're afraid. Because I'm angry. And I'm afraid. I'm afraid for my city. Because at this point now, there are people, and Maria, I agree with you on a lot of points here. There are a lot of people that come from all over the world to die in your district, and that's not fair. But objective reality exists. A question was asked last week, like, where's the DEA in all this? And the answer was essentially like, we can't stop the drugs from coming into the city. It's being produced here. Fentanyl you can make that in somebody's basement. So we have to address this issue, not as we want it to be, but as it actually is. And so, we've breathlessly talked about all the problems. We've breathlessly talked about many of the solutions here. Just as there are a million roads into addiction, there are a million roads out, and it's important that we explore every single one of them until we find things that work. Thank you.
My name is Shanna Farrell, and I represent the Harrogate community. So tonight I'm here for the residents that live and work and are raising their children in Harrogate and the surrounding communities. We are valuable, and our neighborhood is not treated like that. We are good people. And we have been suffering for a very long time with this, but it goes well beyond what has recently come about, the opiate addiction. This all started popping up in the 90s, and I know this because I've lived in a neighborhood for 40 years. So when the city is allowed recovery programs, they're not actually recovery programs. They are just fronts for, making money and stealing money from the state to ruin your neighborhood. This is what you end up with. You attract drug dealers. I'm sorry, closer. You attract the drug dealers because we have a vicious cycle of dealing recovery programs that don't work. And we have Prevention Point, who you work with great, who I think are fantastic. But I have a city contract that says if you bring in one needle, you get 1 + 10. That's why our neighborhood is riddled with needles, not 1 for 1. And then they go out and they also sell them, so you're enabling them. They sell them to get their money for heroin. And this is a vicious cycle, and there's no plan to stop this. And it's Kensington, so nobody cares because they deserve it, because they're poor, because they are diverse, and nobody cares. It's not a race thing, it's an economic thing. We're not rich, we don't have a lot of money. So everybody dumps here and they come here to make their money. And that's what we need to change. And this needs to be part of the plan. Just not what we're going to do for 200 homeless people sleeping under bridges that have a drug addiction, but the residents and what you do, how it's going to affect us and not just them. You know, their families get to do tough love. Can't live with us because you rob us. And, you know, we don't want that in our problem, and our neighbors don't want that. So we deal with it, and we are vilified for it because they rob us. They litter and defecate on our properties. They move into abandoned houses in our neighborhood. It's not just under the bridge. This is much bigger than that. And these are all things that need to be addressed, and it needs to be for the people that live there and work there who will stay there, because they won't. If they get recovered, they're going to go back to Levittown or the Northeast. That's where they're going to go. And then more people are going to bring them here. So when you set something up and it's permanent, you now are going to make us deal with this forever. This has to end. We're valuable. We matter. Thank you.
Thank you, Shannon. So we're going to go through a couple more. You have Gillian Esquivel, Somerset Neighbors already, Jose de Marco, Carol from Angels in Motion, and Dennis Payne. I saw Dennis. Where did he go? I think Dennis left, so I'm going to go down. Katie Rivera, and then Rosalind Lopez. So Gillian Esquivel, Jose de Marco, Carol, Katie, and Rosalind. Again, we gonna honor the clock. If you have something in writing that we can put officially for the record, we will make sure it is part of our record.
Okay. Hi, I'm Jillian Esquivel. I live in the 24th Police District near McPherson Square. I am part of the West Kensington Neighborhood Association. I'm here representing them. The opioid epidemic has affected this neighborhood for years, long before Gurney Street, long before these encampments. But most of the people who live here are in no way involved in the selling or consuming of heroin. And I feel like that's something that gets lost, and I'm encouraged by the amount of talk that is happening here. Since the start of 2018, just this year, I want to share some stories of things that my neighbors and I have seen. So since the start of the year, my neighbors and I have seen a family, mother, father, children, grandparents, trapped in a minivan, screaming as there are hordes of people, 24 people, clamoring for free heroin samples while there are dealers passing it out 10 feet away. We've witnessed children waiting every day on the corner for the school bus, surrounded by 6 drug dealers. They're there week after week. We've seen neighbors and strangers come together during an overdose reversal on our front steps, where Narcan was supplied by a neighbor and it was administered by the dying person's friend. We've grieved over the death of a neighbor's adult son. This is not a comprehensive list of the things that we've lived through in the last 3 months alone. I wish that I could say that these stories were unique, or that we would be surprised if more of it happened. It's the trauma of living here. And unfortunately, these effects of the opioid crisis on our neighborhood are normalized and seen as just a cost of living here, and they have been for decades, as it's been talked about. The children in our neighborhood don't have a choice on whether or not they live here. The adverse childhood effects, ACE scores, that this epidemic brings to these kids will last their lifetime. And change needs to happen now. Thank you.
Hi, my name's Carol Rostischer. I'm with Angels in Motion. I'm going to tell you a little bit about Angels in Motion. I started Angels in Motion over 5 years ago. Actually, it's 3 years officially, looking for my son. My son was on the streets of Kensington, homeless and addicted. And I would come down here looking for him, and through looking for him, I found a lot of lost, lonely souls. And I just couldn't walk by and ignore these people. They're somebody's child, somebody's mother, sister, brother. And for me to go home and not help anybody, just keep coming back and looking for my own son, it wasn't enough. I had to bring more to it than that. Through that, I found a lot of people that I fell in love with. They're good people. They're caring people, loving people. These people are on the streets. They're homeless. There's also people that aren't homeless and on the streets that are addicted. This is everywhere, and we all know that. We're losing 144 beautiful, talented, caring individuals every day. The majority of these individuals are not happy. They're ashamed, and that's what people are not realizing. This isn't fun for them. Okay, they're guilt-ridden, they're lost, they're lonely, and they don't know how to stop. So many have tried shaming them. It doesn't work, and it really doesn't, because I have clients out on the street that can't look me in the eyes when they relapse. They are desperate, but they can't look at me because they're so ashamed. I actually grab their face and make them look me in the eyes, and I tell them, look, I still love you. It's okay. This is a disease. You're not perfect. Let's try again. And that's what they need. They need that support and that guidance, and they need to be able to try again. They need that so bad. There's so much that people are leaving out of this, okay? Empathy is a huge part. I walk into treatment centers daily. I walk into detoxes. I walk into recovery homes, and I see how these people, my people, they're like my kids, honestly, are being treated. There's no empathy. There's no respect. Believe me, if you treat them with respect and empathy, they give it right back. I know. I'm out here every day with them. They give it right back. They're not bad people. They're caring, loving people. Okay, I've seen the 1 minute. All right. All right, so I'm going to go on and tell a story about why I feel Q's is so important. I have one client, okay, young gentleman, wonderful person. He knew my heart and soul was my son who was in Florida in recovery. He knew I didn't see him. He knew when my son sees me, he picks me up and he bear hugs me. And every time he sees me, he does this and he spins me. And this client did this every single time he sees me to give me a little piece of my son, even though he wasn't here. This gentleman called me on Saturday, and he said to me, this was Saturday last year, can you do me a favor and come talk to me? I need some guidance. So I did. And we talked back and forth, and he was having really strong urges. We talked about him contacting his sponsor. We talked about him going to meetings. We talked about him telling everybody in the house. I gave him Narcan, told him, please make sure everybody in that house knows you have that Narcan. He looked at me and said, I don't want to die. I have 4 kids, and I love them, and I love my wife. I don't want to die. And I said, I get that. Please, just keep reaching out. Don't do this alone. If you have to use somewhere with someone. The next day, he used in that house, and he used alone, and he died. His 4 kids now do not have a father. His wife doesn't have a husband. And believe me, I know that's not what he wanted. He wanted to stay in recovery. That's why I feel Q's are so important. Thank you.
Hello. Thank you so much for the opportunity to speak today. My name is Katie Rivera, and I've been living in the Kensington area since 2005. I'm the owner of Flip Out Productions, a gymnastics academy located at 2757 Frankfurt Avenue. Our mission is to provide the highest quality of gymnastics to children of all ages. We support the growth of all athletes, no matter their gender, race, income level, or athletic ability. I started this business in 2012 by myself with a few mats that I bought with money I saved at a part-time job bartending. Our first location was Schistler Recreation Center, also known as Newt's on Blair Street. I began this project with 15 students. By 2016, our partnership ended with Schistler, and I was on a mission to build the best gymnastics facility in Philadelphia. At this time, we were a community of 75 families a week. After a temporary space, a lot of hard work, and 8 months of planning the development of the properties north of Lehigh, we moved our then 120 families in June of 2017 and opened on Frankfurt Avenue. We now service over 260 families a week for recreational gymnastics classes, partner with schools for after-school programming, offer fun and powerful workouts for women, have a mentorship program, scholarship athletes, hold a partnership with the Temple Gymnastics Club, and have a staff of 10 employees. This is only the beginning of what we have planned for this area. Construction is about to begin in our brand new facility directly across the street from our current location. This facility will be able to service approximately 1,000 families in the Fishtown, Port Richmond, and Kensington areas. We are also less than a football field away from the encampments under the Frankfort Avenue Bridge. Less than 100 feet from encampments on Silver Street and the open-air drug trade and drug use that takes place every day. This activity can be seen outside of every window of the facility. Since we moved in, I have physically dragged unconscious human beings out of the street for fear that they would be hit by a car. I have called ambulances countless times for drug overdoses that have happened directly out front of my facility, never knowing if they were going to make it. Did that person survive what just happened? I clean up needles, drug baggies, and trash every morning before I can open my doors, often with my 3-year-old in tow. I have, on more than one occasion, had drug dealers get out of their cars and threaten me when I have asked them to politely move on. I appreciate the increased police presence, although I have offered the 24th District to come to be a part of the facility, meet the kids, use the bathrooms, get a coffee, with no response. I have sent multiple emails and still no response. I feel alone on an island of despair and hope at the same time. I took the security of my facility into my own hands and have a full-time security guard with us for all of our open hours. I am here to take a stand for my community, for my daughter, who is the reason that I want to change the world, for the children that walk under that bridge every day on their way to and from school that cannot be here to voice their concerns, for the kids that I see visiting their parents that live under that bridge, for the young girls that I see every day coming through that are prostituting themselves and disappearing right in front of me, for the parents and the grandparents that come every morning and buy drugs to bring to their sick kids at home. I'm here to take a stand for our humanity. This happening has changed me forever. I have made a commitment to our children and to our families to change the world around us, and I plan to do it. But we need help, and we need help now.
Good afternoon or evening at this point. My name is Rosalind Lopez. I am here to say that I am in opposition of the comprehensive user engagement sites, known as the safe injection sites. I was raised here in Kensington, and I have witnessed individuals drive up in their car in front of my house when I used to live on A in Somerset to inject themselves. Kensington has dealt with drug sales and addiction for more than...
Rosalind, put it closer to you so your voice can carry to the back.
Okay. Kensington has dealt with drug sales and addictions for more than 40 years. It wasn't considered an epidemic back then because back then the majority was Black and Hispanics. Now that Timmy from Delaware County and Jack from Montgomery County and Susan from Roxborough, those are just names that I made up, and many others like them have found their way and got lost or trapped in Kensington, and because of their disease, now it's an epidemic. And let's not forget about the gentrification that's going on right now. Last week, on March 27th, the Department of Public Health held a meeting at Congresso's Pan American Charter School, and 2 things stuck out there: that these cues will not have an impact on crime, and it will not have an impact on the drug sales. So if it's not going to have a positive impact in our community or any other community, there's no need for it. There is no guarantee that addicts will go to a queue upon purchasing their drugs. In fact, they will go to the nearest vacant alley or vacant home or lot and to get their high. The presentation also showed that in 2016, there were 907 deaths attributed to overdose in Philadelphia. And of those 907 deaths, 729 were attributed to some type of opioid. Many addicts, hold on, I can read that. Many addicts become angry or violent when their high is interrupted with a Narcan. I feel that they don't appreciate the help or that they value their lives. I have two brothers who have been addicts since their teens, and they have the ability to be clean for months, even years, but that is a choice that they make. You may classify it as a disease. I call it a choice. They have a choice to get help if they really wanted it. They have a choice to want to live. They have a choice to not want to die or not to use. You know who doesn't have a choice? Our children. They don't have a choice in the kind of education that they get. They don't have a choice in the schools, that their schools close. They don't have a choice that this city doesn't care for their safety or well-being. The city seems to want to help these individuals who have addiction rather than to invest in the children who don't have a choice of their value or quality of life. Some of the suggestions, I see the end time. Some of the suggestions that I have, instead of reinventing the wheel with the cues, why not work with the recovery homes that are already here and the methadone clinics? Use them instead of spending more money on what's going on. Have these individuals who are addicts declare medically incompetent. Okay, so like that, they cannot make that choice to sign themselves out of a recovery home. Those are some of my choices.
Thank you.
Thank you.
Just for housekeeping, I'm going to invite the rest of the folks. We are not going to be able to get through our list. We're going to suggest that everybody who signed up today, because we're going to get through the list of everybody who pre-registered, to please submit stuff in writing. I will ask the chairwoman to recess to the call of the chair so that if we decide that we want to come back and finish some of the conversation, we can. But we are very grateful to Visitation and to the sister and father for allowing us to come into their facility, but we do not, Sister Betty, we do not want to out-welcome ourselves or welcome out, or what is that?
We're on our welcome. Maria, excuse me, Jose was called to speak too. Maria.
I'm brain dead here.
Maria.
So,
Maria, Jose was.
Yeah, no, but I want to call the rest of the people because that's kind of the final of the list. So I didn't forget Jose.
Ready for me?
No one forgets Jose. So it's Jose, Julio Carlos Colon. We have a Dr. Joseph Horacio, who's been very patient from Temple. I don't know if they're still here. Again, I wanted to put some of the residents before some of the other folks. Christian Kahufa, Kristen, Deborah Young, Eileen Blair, Jane Grickets, and Linda Matolo. Those are the people who pre-registered, and we apologize to the rest of the folks. I'm going to read that again. Jose first, Julio Carlos, Dr. Joseph Horacio, Temple, Christian, Deborah Young, Eileen Blair, Jane Grickix, and Linda Matola. Jose?
Okay. Good afternoon, evening, and thank you for this opportunity to speak. My name is Jose DeMarco, and I live 5 blocks away at 5th and York. But I'm a member of ACT UP Philadelphia, the AIDS Coalition to Unleash Power. In the beginning of the AIDS epidemic, for harm reduction, we introduced condoms to people. They were met with arguments of immorality. You're going to encourage young people to have sex. And what happened was people were already having sex. Make a long story short,
the city of Philadelphia distributes thousands and thousands of condoms. So we know that this works. In 1991, more than 50% of all HIV infections were coming from syringe use, people sharing syringes. We know now that providing syringe exchange and folks having access to clean syringes has driven HIV infections down to 8%. So we know that harm reduction works. Last year, Philadelphia, I'm told, recorded 1,200 overdose deaths in Philadelphia. These numbers outweigh HIV infections, they outweigh AIDS deaths. I think it even may be more than homicide rates at this point. We know that providing a medically supervised clinic would save lives. And it's about saving lives. I'm thinking of $1,200, I'm thinking of 1,200 hoagie sandwiches, I'm thinking of 1,200 dead people. That's a lot of people. Imagine that in empty pairs of shoes. But a medically supervised clinic, not only in Kensington, they're needed throughout the city. I've saw syringes in West Philadelphia, I've seen syringes in North Philadelphia, so this is not just a problem. Another argument is against racist policies against people of color and drugs, especially in the policing and the sentencing. It's a problem that exists to this very evening while I'm speaking. But to make a long story short, African American numbers in overdoses have almost reached those of their white counterparts. So withholding compassion for people, for 1,200 dead people is, it's wrong. We can save the lives. These are human beings, these are our brothers, these are our sisters, these are our mothers, these are our fathers, these are young people, old people, black folks, white folks, Latinx. 1,200 of them are dead. History will judge us, humanity will judge us, and God will judge us. This is Matthew 25, verse 40. And the Lord will reply, truly I tell you, whatever you did for one of these, the least of these, my brothers, you did it also unto me.
Dr. Horacio?
Thank you for allowing me to speak tonight. My name is.
Thank you for being patient. I know you've been here for a while.
My name is Dr. Joseph Durazio. I'm a professor, assistant professor in the Department of Emergency Medicine at Temple University. I'm board certified in emergency medicine, toxicology, and addiction medicine, and I work at both the Temple University Hospital campus and the Episcopal campus. This is clearly the worst epidemic of our lifetime. While the destruction of AIDS epidemic peaked in 1995, we've seen the opioid epidemic surpass the devastation of this disease nationally by more than 20,000 people per year nationally. Locally, we've been one of the hardest hit cities in the nation. With an estimated 1,200 people dying of overdose last year, we saw a 30% increase from 2016. The number is shocking considering that 4 times as many people die from overdose as die from homicide in Philadelphia. At Temple, we are tasked with carrying the largest number of patients afflicted with opioid use disorder in Philadelphia with our proximity to the Kensington neighborhood. I've stated over and over again that Temple is the epicenter of this problem, and we need the city's help. Statistically, we are the major care provider for 5 of the top zip codes in Philadelphia where naloxone was administered the most in 2016. What we see at Temple University Episcopal campus, emergency department is staggering and disheartening. Clearly, it's the city's hardest hit emergency department in respects to the opioid epidemic. At any one time, more than half of the patients may be there due to drug overdose or a complication from opioid abuse. It's often overwhelming when I'm working there, and I'm discouraged to think we have yet to get this problem under control. As an emergency physician, toxicologist, and addiction medicine specialist, I've been working tirelessly to engage the patients coming through our doors, to enter recovery with help of medication-assisted therapies, but we've only scratched the surface. Our city's in crisis, and if we don't do something drastic, we're facing at least 1,500 people dying from drug overdose in 2018. In recent weeks, the concept of comprehensive user engagement sites has come under much scrutiny. Regardless of your view of this approach, we all must recognize we need to find a way to engage people who are afflicted by this addiction, take down the barriers for people seeking recovery, because there are many barriers, and increase the capacity for treatment for those asking for help. This requires continued dialogue and a common commitment to finding solutions among providers, government, as well as the individuals, families, and communities affected by opioid use disorder. You know, the science shows that these safe injection sites or comprehensive user engagement sites will decrease the number of needles seen on the streets, active use in the streets, and decrease in infectious disease, communicable disease. We should really look at the evidence-based medicine that's going to help these people. We need to come together as a community to figure out how this can work and best serve the people who are afflicted by this disease. I appreciate your leadership on this critical public health matter and for inviting me to testify. Thanks.
Hello, my name's Eileen Blair.
Can you get closer to the microphone?
My name is Eileen Blair, and I'm here as a resident. I'm not making judgment on users or dealers or any of that. I'm approaching it from a different perspective, as in Conrail. I live at Tulip and Lehigh, so as soon as I open the door, look out the window, I see them, they see me. And I won't get into, everyone has described how awful it is. But I have photos here from 2005. All we wanted was a fence, just because it was like a road there that every criminal and drug addict and everybody else just walked in and out of there free as could be. Police never came because right where I live, my side of the street is the 26th, the opposite side is the 24th. So that means it's the end of the line for both districts and no one comes. And if we do get someone to come, they say, it's private property, we can't go up there. In the summertime, when all the creeps run up there, the cops are all around and helicopters on top. Why can't they go in there? That makes no sense. And I would like you to take a look at these photos when thank you. Just so you can see how long this has been. And the only reason the tunnels are loaded with people now is because they got pushed out by Conrail. They have been living on the railroad for these many years, and now Conrail has an opportunity to make even more money, and so they have pushed all these people out, and that's why they're beneath the tunnels now. And it wasn't such an epic issue because nobody could see them. But I promise you, if you had to walk your kids under that tunnel to go to school, you would make sure something got done. This is just unacceptable that we as residents of this city, or any city for that matter, that it should be okay. What's okay about that? There's nothing acceptable about that, and I ask you to look at those pictures, and I'm willing to volunteer. I'll do anything that I'm asked to do. That's it.
Hi, good evening. I'm reading on behalf of Jane Greikos, who couldn't be here. My daughter died on March 15, 2018. Her name was Jessica Ney. She was 36 years old. If I don't speak out to make a difference in the heroin epidemic that has taken over our country, then I'm doing a disservice to my daughter and the life she struggled desperately to leave behind. Her life and death revolved around using. We spoke about the life she wanted, and it was not the life she led. She desperately wanted to be a significant part of her daughter's life, but her addiction was stronger. I was told on March 15th, she begged the staff at Valley Forge to let her stay, but she was told funding was up and she had to leave. What a disservice to any human being asking for help. At about 12:26 p.m. on March 15th, she was given a citation for attempting to inject an unknown substance in public. That, in my opinion, was a scream for help. Instead of helping her, the police officer gave her a citation for $50. Move along. Is that what you wanted my daughter to do? She was doing illegal drugs in public and was told to move along. She did move along, as you suggested. She went home and injected the unknown substance alone, out of police view, out of anyone's view, and there she died alone. My daughter is dead. My daughter is dead. Yet to the treatment center, it wasn't about treating the disease, it was about getting paid. To the police officer, would it have been so difficult to show a little compassion? This was my child. Do you have children? Could you imagine your child being treated in such a way? Addict or not, no human being should be treated the way she was on her last day on earth. At about 4:45 p.m. on March 15th, she was pronounced dead. My daughter is beautiful, intelligent, funny, lonely, desperate, pleading for help, and dead. She struggled to fight her demons. If the facility offered her an extra day, or if the police officer either got her help or put her in jail, would it have made a difference? I don't know the answer. I never will. I pray that those who make change happen find it in their hearts to do so. Sincerely, Jane Gricus.
Hi, everybody.
You got to talk close to the microphone.
Sorry about
Put your name for the record.
Hi, everybody. My name is Deborah Young. I'm an advocate, I'm a peer mentor, I'm an intervention specialist. I'm a homeless advocate that has seen it all on the streets. I am also a woman in long-term recovery for 13 years. First, I want to thank you all for having these testimonial meetings that could save thousands of lives. The drug crisis here in Philadelphia and nationwide is a public health emergency that demands all of our attention. For all of us to advocate harder to save lives. The CDC reports emergency room visits have skyrocketed by 70%. That's including the heroin and fentanyl overdoses. This number alone says how many people are doing drugs and dying. We need more funding to help prevent this deadly epidemic, this disease, from killing our children and our families. And there are not enough detox beds here. The number of beds is so low that people who want help get turned away. They have to wait days or weeks to get the help and get into treatment. By the time a bed is ready, that person is dead. I myself have experienced the loss of family and friends. In the last 2 years, I've lost 8 people that I love dearly. Excuse me. The devastation to our families is horrible. One day wait means more deaths. More funding is needed to get more treatments, more beds to help. Drug overdose is a leading cause of death in the United States. We need to fight for a healthy society, a meaningful way of life for families, and protect the most vulnerable and homeless. Drug overdoses have killed, in 2016, 63,632 of our mothers, children, aunts, uncles, fathers, grandparents. Prescription overdose by the CDC increased by 20%. Heroin-related overdose increased by 19.5%. Cocaine-related overdose increased the death by 54%. Psychostimulant-related deaths increased by 33.3%. We need to protect the people with substance abuse addiction by expanding treatments, getting access to beds, prevention, and recovery services. To prevent drug overdoses will require coordination of law enforcement, first responders, mental health and substance abuse providers, public health agencies, and community partners. We need funding here. Every single street in Philadelphia seems to have drugs. Everywhere you look, people are dying. I gotta be honest with you, I don't know about these safe injection sites. I know if we have more, I'm out there on these streets and I see what is going out on these streets. I am out there trying to help like many, many thousands of advocates, DBH, PROACT, CBH, I mean a lot of agencies are out there helping. There needs to be more funding to get people into these treatments. Why are there 50 detox beds in Philadelphia? 50. When you got 500 people needing to get in. So if you got 50 detox beds and there's 500 people wanting to get in, you got 450 that are gonna die, waiting to get in these treatments. That's where the funding needs to go. We got trillions of dollars coming in Philadelphia. How about spending them to save our people, our children, our grandchildren? Because you don't know, I'm scared to death for my grandchildren. Is it gonna be one of them that goes out in that street and somebody hands them, here, try this for free? They were putting it in candy. Is it gonna be one of my children? Is it gonna be one of my grandchildren that I go to the funeral, like I went to my friends' funerals and seeing that coffin? I refuse. I will be out there fighting and doing all I can, and so will many other advocates, but we need that funding to help people instead of killing them. That's all I got. Thank you. Thank you all.
We're going to close out. I just wanted to acknowledge our former colleague, Dennis O'Brien, who is here with the CBH group, Deputy Managing Director Joanna Otero Cruz, who led some of the cleanup efforts and has monthly meetings in El Barrio Es Nuestro. You should get information about those of you who are interested in some of the cleanup. I want to thank Hector Ayala and Tony Valdez from the Latino Behavioral Health Coalition and some of the other providers, Reagan from NET, Mel Wells, who was here from ODAP, and others who have come in to listen to the community. And I personally want to thank my colleagues and our chairwoman for allowing us this opportunity to put some things on the record about what the efforts of the city, as we've heard, as one of the council reps, and I'll let Councilman Squilla also add to this. This is not acceptable. This wouldn't be happening anywhere else in the city. This is not a time to point fingers, though. This is really a time of how do we better coordinate? How do we hold the system accountable? How do we add transparency? How do we ensure that patients, these low barriers to entry, that the fact that we're still debating an ID requirement and some other things is just unacceptable. And if this is a crisis, then a $4 million allocation is not sufficient. We didn't know we were going to win the Eagles, but guess what? We come up with the money for the parade. Tomorrow we'll have another parade. When you listen to it's going to take $400,000 to manage 40 respite beds, we're going to spend that tomorrow in the parade. And I don't want to be for those of you who are sports fans, it's a priority. And if it's a real crisis, our budget should reflect it. I do appreciate that this administration and Mayor Kenny, who's joined us out here on several occasions, is much more committed to this than we were in the past, but it is not enough. And so I want to thank all of you and continue to encourage all of you. I want to thank those of you who clean your streets every day. The folks who are we're warriors. To the children who have to walk through this every day, for the families at visitation, for these children who have to walk through this every day. This is not an either or, it is an and. And for the residents to have faith and confidence that the city is going to do the right thing, we have to protect them. And then you can take care of the others. It has to happen at the same time. And so I don't think anybody here is working as cross purposes. We all have family members under addiction. I can tell you I've been to funerals. As I've explained to the administration, it's not 1,200 people. I can list names. Sammy Netties, I got folks within my own family, and I don't believe that the system is doing enough. I don't think we're reforming ourselves enough, and I don't think we're supporting the stuff that is working enough. And so with that, Madam Chair, I thank you and all my colleagues for coming this evening.
Thank you, Councilwoman. I want to join with my colleague, Councilwoman Maria Quinones-Sanchez, and actually, I want to thank her for all of her hard work. Can we give her a round of applause? Because she really has worked so hard, and we all have, but the Councilwoman is ground zero for the epidemic that we see here in the city of Philadelphia, and she's a fighter like no other. So I just really want to say that I appreciate you and all of the work that you've done on behalf of all of City Council. And I want to thank all of my colleagues for being here tonight. I would like to open it up for comments if anyone has any closing comments that they would like to make before we depart. But there's one thing that I just want to add, and that is for the last young lady who spoke, who, she spoke about her fear and her fear for her child or her grandchildren. And that is a fear that I think all of us have. We are all very much afraid because I don't believe that addiction is a choice. I don't believe that anyone who's over in those encampments, and I've been there numerous times, I don't believe that anyone is there by choice. I think if there was a choice, an option, an opportunity, that people will take it to get out of that situation. So we need to work together. We need to find remedies. And we want you to know that despite whatever you may read, and I know that there are some folks who who have trashed City Council before about this issue and are going to trash us again, but that's okay. We are here to fight for those who are in need. And we may not agree with all of the remedies that have been put on the table, but we are here to represent and to be helpful and to figure out a remedy for this solution, for this situation. So with that being said, if any of my colleagues, Councilman Squilla.
Yes, thank you, Madam Chair. And I just want to say one thing too. We know there's not just one answer to this epidemic. We can't just do one thing and resolve the whole situation. And this has to be a multi-pronged approach, and things that we need to try. We have evidence based on certain things that work now, but 10 years from now, they're going to say the evidence-based things we're doing today are no good. They don't work. We're going to do something new. So we have to think outside the box on some things, and we have to look at other aspects of how we can treat this situation. But while we're doing that, and I think the chair said it perfectly, while we're doing that, we also have to look at the people that are surrounding being affected by what's going on in the streets too. And we have to do the same thing, because this is not, you can't just do one thing to help the people being affected with the addiction, but also the people being affected by the people who are being affected by the addiction. And it's a multi-pronged approach to be able to handle both things, and it's not easy because it hasn't been done anywhere yet. We've talked to people from all over and all cities, and everybody's looking at each other to find out what they're doing best. And so we need to look at all these approaches, try them, and if they don't work, try something else, and just keep going. But knowing that people have to see something, and they have to see action, because if they don't see action, they think nothing is happening, and that's where we were lacking up to this point. I believe we're going to do something into the future. I see that we have opportunity to try some things, and we're working toward new choices that we're going to make in the future. But we have to work together with not only our advocates. We have so many great advocates out there. We have our homeless advocates, our CBH, DBH, the police, the community leaders. Everybody has to be involved in this, because it's not, one person's not going to be able to solve it. And I want to thank all the people who came and testified, because what they didn't do is just tell us what the problems were. They actually came up with possible solutions and ways to fix this thing. And that's what's important, because I know a lot of people think all the elected officials have all the answers, but we don't. So listen to those ideas out there from the public are really helpful, and hopefully we can implement some of those ideas moving forward. So thank you for your time and efforts, and thank you, Madam Chair and Councilwoman Sanchez, for all the work that you've put into this.
Thank you, Councilman. Councilwoman Helen Gim.
Thank you very much, Madam Chair. First, I just want to open by thanking my colleagues here in City Council, and especially, of course, our real warrior, Councilwoman Maria Quinones-Sanchez, on this issue. I thought that this was an incredibly powerful meeting. I'm sorry that I couldn't be here earlier, though I did read everybody's testimony, those who submitted for the March 12th, and will certainly be reviewing all of it today. I'm really thoughtful, especially for the people who came out and spoke for children. As chair of children and youth, as somebody who came in to City Council with a real focus on what it meant to grow up as a child in this city, I am very, very grateful to the parents, to the children's advocates who are out there. We are trying to drive as many resources as we can to be thoughtful and to concentrate them, particularly in areas of high need. We've doubled the number of social workers moving into schools. We brought back nurses and counselors. We have to do so much more. But those who spoke on behalf of young people who witness horrors that go far beyond anything that any child should ever see in those years, I'm grateful to you. We hear you. We need you to be louder about it. We have to make sure that our kids grow up recognizing that this is not something that's normalized. It's also not something that's going to be condemned. And I also want to say that, you know, I agree with all my colleagues that this is more than one solution. But I do want to say I came out early on the comprehensive user engagement sites, in a large part because it had to do with the idea that we were going to do something different when this crisis hit. I wasn't around during the crack crisis. I wasn't in a place where I could do things. But in this system, we have to do something differently. And some of it is about letting our children know that when crises hit, we're not going to step over bodies. We're not going to condemn people. We're not going to criminalize this issue. We're going to try and figure out a solution. I've had a chance over the last couple of months to visit 2 safe injection sites in other parts of the world to hear them talk about what it means. And it's not only that they save lives, but it's also that they help communities deal with a critical problem. They take drug use and illegal drug use off the streets. They clean up areas that are filled to the brim with the paraphernalia and detritus of drug usage. They help coordinate services that drive attention to police and advocates and health experts and hospitals. They're not perfect. They're struggling with the same questions, but they looked at me when I asked them that I was worried that you might enable, and they dared me to ask how I could judge them. When we had 57,000 people die in this country of overdoses, when we had so many people die in our own city, don't judge them. Ask yourself, what more are you doing? And why we have to apply everything possible. So I'm committed to figuring this out. I'm glad that we have a health department and a city that is trying to figure it out. We have to do so much more. I want to partner with all of my council members to make sure that whatever solutions that we put forward comes with the money, the passion, the civic engagement, and the attention that this community, as much and if not more so than any other, truly deserves. So thank you.
Thank you, Councilwoman. Councilman Don. No. Councilman Green.
Thank you, Madam. Thank you, Madam Chair, and thank you, Councilwoman Maria Aquino Sanchez, for always addressing these issues and keeping these issues on the forefront. I want to thank all of the people that testified here and bring your voices here on the issues you're dealing with as residents in the communities that are being afflicted by these addictions, and also by those who are speaking on behalf of those who are addicted. But I want you to also hold us accountable. Not just one evening, but hold us accountable when some of the news stories start to dissipate. You don't hear about it as much. We need to continue to hear your voices to hold us accountable. And I agree with my colleague, Councilwoman Sanchez, that this is an and issue. We have to find ways to provide public safety and also help for the residents in this community, as well as help those who are addicted. And we also need to hear your voices, not just in events like this, but in our city budget hearings. So when we have public testimony, we need to make sure that people realize this is a priority and that people should not be suffering in silence, they should not be suffering in their communities, and that we need to make this a priority in how we allocate dollars. So we need you to continue to hold your voices out there and hold us accountable so we can try to come up with solutions to address this complex issue. Thank you.
Thank you. And with that being said, and there being no other comments, this meeting is adjourned until the call of the chair. Thank you.